Dr. Mega, thank you so much for joining me today.
Oh, thank you for having me here.
Tell me a little bit about this big leap you made from academic medicine to the private sector. What prompted that for you?
So I love being a cardiologist, and the most important thing is being able to spend time with patients and trying to involve myself in things that help them. And when the opportunity came to join a group like Google X, it really felt like the right thing to do. I think patients and providers need to lean into this tech revolution. So I made the leap.
So it's coming whether we like it or not. We might as well get on board?
Have a seat at the table.
Tell me a little bit about some of the exciting projects that you're working on.
One project that we're working on, I think, really embodies what we do at what we now call Verily. So we were Google X, and now we spun out as an Alphabet company. We work on tools to collect information, some of it's known information, some of it's unknown signals. We work on the infrastructure to organize it and then make it actionable. And one project that really exemplifies that work is the Baseline project, which we're doing in conjunction with Stanford University as well as Duke.
And you had a huge outpouring of support for that project, didn't you?
It's been phenomenal to see how people and participants, when we put them at the center of these research initiatives, how excited they are about the effort. And this really is going to be an incredibly interesting project that follows people over time. We know that care certainly is provided in the four walls of the hospital. Research takes place in the four walls of a clinic. But you and I, we live our lives in this beautiful environment. We have different things that happen to us, and how do we capture all of those inputs so that we can understand disease before it happens?
So people aren't hesitant to give up this really sort of precious data and, give it to you?
Well, we really think about it, and that's what's been so great about working with Duke and Stanford, really groups that have thought about patient-centric research for years. And when you find a mission and you find people who see value in it, whether it's the researchers and equally important, the participants, then it ends up being something that works for everyone. And so in this case, the participants are going to get a fair amount of their medical data back. And so they are actively part of this process.
For example, there's some legal protections now kind of protecting medical data that's collected for research from being used to, for example, determine insurance premiums. But what if those legislations are repealed or new legislations? Is that a worry at all?
I think that we should all be paying attention because medical data currently is sitting all over the place. It's sitting in filing cabinets. It's on flash drives. We need to put the right security and privacy in place so that we have the trust that we need to try to think about the next generation of cures. I think we've gone so far in medicine. If I even think about it as a cardiologist and being part of cardiac research, what we're doing now is different than what we were doing 5 years, 10 years, 20 years. But unless we have these protections in place, it's going to be very hard to continue to push on all of this great work.
And you mentioned that data is kind of siloed at this point. Do you think private sector is really the right place for data? When I think of wonderful data projects or research studies, they're usually out of places like Sweden or the Netherlands that have a more national health system or registry. And I think some people have a little bit of suspicion that putting this in the hands of various private sectors may not have incentive to communicate with each other.
Part of it is making sure we have the right infrastructure to share data. So there is a revolution going on in computing. It used to be about where you compute. What physical server do you store your data on? And nowadays, with new technologies, we're able to more rapidly share information. And I think it's those kinds of tools where certain groups are going to be particularly well-versed at creating this construct so we can share data. And that's where I see tech companies really playing an important role.
Do we have to just trust that a company like Google is going to do the right thing with this data and share, or are there promises the company's making? How does that work?
With Baseline, we've worked with the community broadly, and I mentioned some of the stakeholders earlier, and there is a commitment to make this data available to qualified researchers, so this is a resource for all of us.
That's wonderful. So we're kind of harnessing the power of the private sector to solve problems encountered throughout the health system.
This is going to take a huge ecosystem, and if there's one thing I've learned is that you can't do healthcare in a corner. It's something that really takes a lot of parties coming together, and I would say that's true of all of the projects we're working on.
I would certainly agree with that, and you certainly have the energy, the background for the job. I'm so excited to see what you come up with. Thank you so much for speaking with me today.
Absolutely, thank you.